Around the country, millions of Americans are receiving their COVID-19 vaccines, and it is making an impact. You may have questions about the vaccines, like how do they work? I'm Dr. Chris Francie, and today I'm honored to explain the science behind these vaccines and more. So what is a vaccine? Vaccines essentially train your body, or immune system, to fight against a certain infection by imitating what causes the disease. For example, you may have previously received vaccines that contained a weakened version of a virus. Vaccines like this are designed to not be dangerous, and their purpose is to get your immune system to recognize it and initiate an immune response. This can include making antibodies and recruiting other immune cells. Your immune response builds over time, and eventually it will remember and protect you from the disease if it sees the real thing. The COVID-19 vaccines work a lot like this. However, instead of a weakened virus, they provide the instructions for our bodies to make the spike, or S protein. The presence of the S protein then mimics infection with SARS-CoV-2, the virus that causes COVID-19. Although all of the vaccines lead to S protein, each vaccine does this in a different way. To better understand how, let's first examine how the body makes protein. It all starts with DNA, which is in our cells and has many functions. One main role is it stores instructions for making proteins to do certain jobs in the body. But in between these steps, DNA helps create messenger RNA, or mRNA. This serves as a temporary message with the instructions to make protein, like the S protein. This process is critical to helping us understand how the COVID-19 vaccines work. For example, the Pfizer-BioNTech and Moderna versions are mRNA vaccines. The Johnson & Johnson version is a viral vector vaccine that uses DNA. And the Novavax vaccine is a protein-based vaccine. Let's talk about each in a little more detail, starting with the mRNA vaccines. These mRNA vaccines consist of a lipid sphere, or fat droplet, surrounding mRNA. Once injected into the body, these lipid mRNA molecules get into your cells. There, they instruct your body to make the COVID-19 virus spike, or S proteins. Your body will recognize that this S protein is not normal, and thus start making antibodies to target this protein and initiate other immune responses. Once enough time passes, your body will build immunity and remember the S protein. If it sees it again in the form of the actual COVID-19 virus, it will spring into action and stop it in its tracks. Now, let's take a look at the Johnson & Johnson viral vector vaccine, which contains DNA. This is considered a viral vector vaccine because DNA, instead of mRNA, is packaged in another type of virus called adenovirus, which is engineered in this case to be harmless. The adenovirus serves to transport the DNA for the S protein to your cells. Once inside, the DNA serves as directions to make mRNA, which then instructs the cell to make the S protein. In a similar fashion to other vaccines, your body produces antibodies and additional immune responses against the S protein. The last vaccine we'll discuss is from Novavax. This is considered a protein-based vaccine. This vaccine skips the DNA and mRNA steps and instead consists of particles displaying multiple S proteins along with additional materials that help boost your immune response. Once injected into a patient, the immune system recognizes the S protein as foreign and initiates a similar immune response. Now, if you have received a COVID-19 vaccine, you may have experienced some unpleasant side effects, such as injection site soreness, fever, fatigue, and headache, to name a few. Don't worry, these symptoms are normal, and many people experience them. This is a result of our immune system working hard to protect us. Some have concerns with these vaccines because they were developed so fast, and that's understandable as any therapy includes some amount of risk. You may be wondering, can it give me COVID-19? Will it become a part of my DNA? Is it safe? The FDA recommended emergency use authorization for several COVID-19 vaccines after clinical trials in tens of thousands of people. Plus, they have been administered to millions here in the US, so you're not the first one. Because only a piece of the virus is in your body, you can't get COVID-19 from the vaccine. Also, due to their design, this mRNA, DNA, or S protein cannot become a part of your DNA. Finally, if you're wondering which vaccine is best, just know that whichever vaccine you receive, it will significantly help protect you from serious disease or death from COVID-19. To learn more about COVID-19 vaccines and AdMed, visit our website below.